missionary infected with Ebola home to the United States. Tonight, Dr. Kent Brantley is at a hospital in Georgia after traveling on board this highly specialized medical plane inside an isolation tent to protect the crew. On the ground, this ambulance carried him through the streets of Atlanta to that hospital where he is now quarantined. ABC's chief medical editor, Dr. Richard Besser, who responded to major outbreaks as acting head of the CDC, is at that hospital tonight with the dramatic images that follow.
Walking. That's him on the right, the first Ebola patient ever in the United States, in full biohazard suit, supported by a medical worker. It's a hopeful sign. The plane carrying Dr. Brantley touched down here at Dobbins Air Reserve Base at 11:20 a.m. He was held for the crew's protection in an isolation chamber like this one, developed by the CDC to transport those stricken with the most dangerous diseases. Dr. Brantley was then taken from the base to Emory University Hospital. He got out of the ambulance and, under his own power, walked into the special entrance of the hospital. This is the isolation room he is now in. And this is how his doctors will look.
We put tape between the uniform and the gloves just to form an extra barrier.
It's a demonstration by the University of Nebraska Medical Center. Anyone going in to see Dr. Brantley will be completely covered like this. Gown, glove, and taped, faces behind protected plastic. The Ebola virus spreads by contact with contaminated body fluids. That's what the medical staff here in Atlanta must avoid. I'm hearing people in Atlanta are really scared and think this is a bad idea.
I understand the public concern. This is a new infection for the United States, but we really think that we have processes that maintain, again, the safety of not just the patients, but the general public at large.
There's no medicine that defends against Ebola, no cure. What can you do from here that he couldn't get in Liberia?
A lot of it is sort of the really important supportive care. So it's frequent vital signs, IV fluids if necessary, blood transfusions if necessary.
The fact that he entered the hospital walking is a tremendously encouraging sign to doctors and to his family.
It takes a lot of worry and care about other people to put your own life at risk for people you don't know. That's what it takes to make this world a better place.
We've learned that Dr. Brantley's wife, Amber, has arrived and has seen him. There were tears of joy when she saw that he was walking.
Okay, Rich, but there is still a second infected American patient who will be brought from Africa soon. What can you tell us about how she'll get to the U.S. and when she arrives?
Yeah, her condition is still serious. The good news is the plane has already left Atlanta to bring her back here.
Dr. Besser, thank you very much.
Every day, they worked with one of the world's deadliest viruses. And now, 2 Americans are sick with Ebola.
We just pray that God will have mercy on them and that they survive this.
This is Dr. Kent Brantley, a 33-year-old father of 2 and medical director for Samaritan's Purse, an American charity group helping fight Ebola in Liberia. He recognized the symptoms and placed himself in isolation. His colleague, aid worker Nancy Wright-Bowl, also tested positive for the disease. Wright-Bowl is married and a mother of 2.
They care about people. They care about Liberians. And from the time that Ebola broke out up until this very day, nobody's talking about leaving.
Dedication in the face of the deadliest Ebola outbreak ever. Since March, more than 1,000 cases have been reported in Guinea, Sierra Leone, and Liberia. 660 of them have died. And there's no sign the epidemic is slowing down.
It's probably going to be several months before we are able to get a grip on this epidemic and this outbreak and reduce the numbers of cases.
And now growing fears that the virus could spread beyond the 3 countries at the center of the outbreak. One Ebola patient has died in Nigeria, Africa's most populous nation. So containment is key, but that's no easy task. Our own chief medical correspondent, Dr. Sanjay Gupta, saw firsthand just how cautious Ebola aid workers are before handling the sick.
Multiple pairs of gloves and masks. The head is completely covered. A multi-layer gown, boots, and then an apron. It's positively suffocating in the 100-degree weather.
These are the final pair of gloves that we put on.
Preparing to treat a patient with Ebola is like preparing to land on the moon.
Doctors aren't just fighting Ebola, but misinformation as well. Some people in these communities believe the epidemic is a punishment for past sins. Other local leaders spreading rumors that white people are conducting experiments on them and they're breaking quarantine.
People are isolated, they're afraid, they're scared, they think that outsiders are bringing Ebola to them instead of trying to help them get rid of Ebola.
A tough fight for affected families in West Africa and here at home in America. In Texas, at the home congregation of Dr. Brantley, a simple message on his church sign, "Pray for Kent."